This is the load and shift test. The subject sits with no upper trunk stabilization and the involved arm resting at its side.
Rest your arm at your side, please.
The examiner stands slightly behind the subject while stabilizing the clavicle and the scapula with one hand. With the other hand, the examiner grasps the subject's humeral head with the thumb posteriorly. The examiner's remaining fingers are located anteriorly. The examiner places an axial load along the shaft of the humerus in an attempt to compress the humeral head into the glenoid fossa. With the load applied, the examiner translates the humeral head first anteriorly and then posteriorly. Positive test is an anterior-posterior translation of the humeral head greater than 25% of the diameter of the humeral head when the load is applied and is considered to be a positive test. A test should be repeated bilaterally for comparative findings. Implications of a positive test are excessive translation would be shoulder instability, positive local pain in the rotator cuff, ligament, or tendon damage. Some comments to look into are translation between 25 to 50% has been described as being a grade 1 positive test. Greater than 50% translation is associated with reduction of the humeral head is considered a grade 2, where the same amount of translation without reduction is recognized as a grade 3 and the most serious type of shift.